Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist. Hope you are doing well. And this video is for you if you have been told by so many professionals, so many people that they can help to resolve your back, butt, or sciatica pain, but you're just frustrated. You're super skeptical to try anything moving forward because it has not worked. So in this video, I'm going to share with you the 4 reasons why other people have not been able to fix you and why other professionals have not been able to help you, even though they have led you on and or led you to believe that they can. So if that is you and you are watching this video, be sure to check out my free workshop above where I share with you some different tips, tricks, and some insights to help you understand how you can be empowered and in control of resolving your own pain, even if nothing else has worked. All right, so again, this is Dr. Charlie Johnson. I'm a physical therapist. I have my board specialty in orthopedics, and I help people all around the world by teaching them how to resolve their back, butt, and sciatica problems naturally using the power of the mind and movement as medicine. And in this video, I want to share with you again the 4 reasons why you've tried lots of different stuff and have been told by lots of different people that they can help you, but they haven't been able to. All right, so first things first, realize that the reason that other people cannot resolve your pain and or have not been able to help you is because only you can help yourself. It is your pain experience. It is not anybody else's pain experience. And so because you are the one who experiences your pain, and therefore you are the one who created it, not intentionally per se. Maybe there was an injury, maybe there was something else going on in your life, right? But at the end of the day, it's your pain. And so you are in a very powerful position. But if you're watching this, you might feel powerless. You might feel powerless because you're looking outside of you to resolve your pain when the healing needs to come from within. You're in control of your mind and your body. No one else is. And so, yeah, you can go to someone and they can try to fix you. They can try to do different things to you, acupuncture, chiropractic, dry needling, massage, all this different stuff. And they can do that, but it's going to work temporarily. And so I used to, when I taught at the University of Southern California, when I taught in different places, I used to teach manual therapy, all right, hands-on treatment. And I was very good at fixing people in the moment, but I realized something. I was terrible at giving people what I knew, and people like you in pain were terrible at fixing themselves, and therefore the results were very short-term, right? And so the problem always came back. So at the end of the day, realize it's your pain experience, it's not anyone else's. And so you're in a powerful position because it's something that you can feel and only you can feel. And at the end of the day, if you're not given the tools, knowledge, and understanding you need to resolve your pain, then you're going to feel good when you go somewhere for an hour, for 10 minutes. But then when you get in the car, you go home, it's Saturday, it's Sunday, you go on a vacation, something like that. Guess what's going to happen? You're not going to know what to do to resolve your own pain. Okay, so the first reason 1 of 4, why you are burnt out and frustrated and why everyone says, hey, I can fix you, but they failed to, is because only you can fix yourself. It's your pain experience. Nobody knows what you're feeling. And therefore, because you are the one who knows what you're feeling, are in the best, most powerful position to resolve it if you are given the right tools, knowledge, and understanding. Again, this is what I aim to do for people all around the world. I want to equip you with the tools that you need to resolve your own pain. So that's reason number 1. Reason number 2, that others have not been able to fix you. You have followed a lack of a scientific method, or, again, it's not your fault. You're going to them to try to fix you, but they're not following a scientific process, all right? And what I mean by this is that if you've tried everything, realize that that's not trying everything. The definition of trying everything is literally not trying any one thing, all right? And so if you've tried everything, then you've been very unscientific in your approach. And the people who have given you a sheet of exercises had no clue what they were doing. The chiropractor who cracked your neck and your back and pulled on your leg and yanked on your hip and twisted this and twisted that didn't know what they were doing. They threw 5, 6, 7 ingredients into the pot, stirred it around, and it came out tasting really yucky. And people wonder why they try everything and it doesn't work. Interesting that chiropractors, PTs, medical doctors, right? Scientific professions. We get doctorate scientific degrees. And yet, nothing about what we do, or very little about what we do in our approach, is scientific. Scientific method, right? You create a hypothesis, you set up a test. You test things systematically, not randomly. If you had an experiment and you decided to change 5, 6, 7, 8, 10 different variables at once, how would you know the cause of whatever outcome occurred? Why did you achieve the results that you achieved? You wouldn't know. And here you are watching this video. You've tried everything, which really just means you haven't tried any one thing, and you're frustrated and you're confused. And the unfortunate part about it is that because you've tried everything, you've done all these different things, and you haven't done any one thing, and you haven't been scientific about the process, and the people you've worked with haven't been scientific about the way they've approached this, you haven't learned anything. And so lots of people see treatment not working as failure rather than feedback. But again, if you haven't approached your treatment scientifically, you haven't actually learned what works or what doesn't work. And so somebody like myself who is scientific in helping people with back, butt, piriformis, SI joint, hip, sciatica problems, and understands how to systematically approach resolving this and isolate variables and test one thing and know what things to test and what not things to test, if what I deliver doesn't work, then we know and we learn what doesn't work. We can be sure that if you try one thing and it doesn't work, that one thing didn't work and we can move beyond it. But if you're trying everything and you've tried everything in the past, then all I know is that you threw a bunch of stuff into a pot and it didn't come out the way that you wanted. And that stinks. You know why that stinks? Because we've got to start a bit over, okay? Luckily, again, there's a process for resolving pain, though, that works, okay? And once you get a hold of this process, you can start to tease things out and learn what works versus what doesn't work, all right? So that is the second reason why everyone's telling you, hey, we can solve this. And they can't, because they're not following a scientific process. And so if they're doing a bunch of different things, you want to ask them, hey, how do you know if this one or this one or this one or this thing that you're doing is working? How do you know that exercise number 3 isn't counteracting exercise number 1? How do you know that exercise number 2 wouldn't work, but because you're doing exercise number 5, it won't work? It's a good question. Ask these questions. Ask these deep questions. See what they say. And if they stumble and they have no clue, you know you're in the wrong spot. All right, so the third reason why people have said, we can help you, and you're like, I'm just worn out. I'm just tired of being told that people can help me and not seeing the results that I'm looking for. By the way, does that mean you've quit? Does that mean you've given up? The only way to fail when it comes to getting better, if you will, is to quit, is to give up. All right? The third reason why people have said, we can help you, and you're just burnt out at this point watching this video because they haven't been able to, is because they are missing the key component, arguably 50% or more of what is required to heal. They're missing this key component. They're not addressing it, and they don't know how. They don't understand this. All right, let me show you this. See this? Stick figure. I love stick figures. What's up top? Mind, that's your head. Stick figures can teach you so much. All right? What's below? Body. And you know what that red arrow indicates? Where everybody focuses their treatment. Isn't that weird? Stick figure. Everybody forgets about the big circle on top, and everybody goes to the body. There's a reason I drew the mind bigger than the body. Right? Your body is an instrument of the mind. It does what your mind tells it to do. It feels what your mind tells it to feel. And so your pain experience is simply a negative feedback loop. Here's what happens and why what you're doing isn't working. When you move body, it starts to hurt. Maybe the way you bend, lift, twist, whatever. Then, when you move and it hurts, it tells your mind, hey, I shouldn't move. You become less confident. You become more fearful. You become more worried, concerned, avoidant of certain movement. Mind construct, body, mind. The more worried, concerned, less confident, avoidant you become, fearful of movement, afraid, scared, right? The less you move your body. Now we're back to the body. Then we go to the mind. The less you move your body, the less confident you become. The less confident you become, the less you move, right? And you can see this is just a negative feedback loop. It's a trap, right? And so body-brain, or body-mind, mind-body, right? And it's just this negative, vicious cycle. You start to develop this negative association between movement and pain and fear. Movement and pain and fear. And you can't get out of it. And so notice how I didn't just say, when my body hurts, I move less, and when my body hurts, I move less, and when my body hurts, I move less, right? What makes you move less? Your mind. You become fearful, you become worried, you become avoidant. Why wouldn't you, right? And so you get trapped in this mind-body negative feedback loop. And so body is half of it, right? Mind is at least half of it, if not more. I would say 80% of healing, if you're watching this and you've tried lots of other things, lies here, all right, in your mind. Shifting your mindset, shifting your current pain paradigm, your understanding of what pain is, what pain isn't, how your mind influences the pain that you're experiencing, how your body and your mind, just like I said in that negative feedback loop, are connected. When you move your body, it feels good, you start to become less fearful. As you become less fearful and more confident, and you understand what pain is, you understand that what you're doing isn't damaging you, you start to move more. The more you move, the less fearful you become. Less fearful you become, the more you move. And you're on your way to healing. People don't understand this, though. You see? You go to someone who understands the brain and pain. A psychologist. Someone else. A counselor, right? And isn't it interesting that they only focus on the mind, right? They don't understand the body. And so all pain is due to the mind. Okay, cool. But what about, I want to get back to running. Can I do that? Oh, well, we don't talk about that. We don't know that stuff. Okay. Now, you go to a PT, you go to a chiropractor, you go to an orthopedic specialist at the Mayo Clinic, the best person in the world, for the LA Kings. All right, they know everything. On the body side of things, and I would argue they don't, all right? Because if what you've done has not worked, then clearly somebody's missed something, right? But you go to this person, and the mind, that stuff's weird, that woo-woo stuff, all right? We're just gonna look for this, and we're gonna do MRIs, and we don't see anything, we're gonna make something up just so that we can try to do some treatment, just so that there's something we can say that we're trying, even though we don't really know what the heck's going on, right? And so it's very divided. You go to someone in the traditional medical world, most people are going to look only at the body. They're only going to focus on that bottom circle. You go to other people, psychologists, things like that, they're only going to focus on the mind. They're going to ignore the body. Notice there's that little neck connecting the two. You've got to understand they're connected. They're all within the same system. But at the end of the day, body is instrument of mind. So if you find someone who's treating pain and they only understand the physical side of things, guess what? It's not going to work. So you're barking up the wrong tree over and over and over again. It's no wonder you're watching this, you're banging your head against the wall saying, I've tried all these treatments, everyone's promised they can fix me, because they don't understand half the equation. So that is the third reason. All right? Fourth, final reason, myopic treatment. Myopic, looking through one little lens treatment. If the only tool you have is a hammer, everything's a nail, right? And so I vouched and committed to, as a PT, I'm studying almost every facet of the body side of treatment, the structural side of treatment. Chiropractic, osteopathic, acupuncture, dry needling, Pilates, yoga, orthopedic medicine, worked with hip and spine surgeons, pain management, understood radiology, right? What else? Feldenkrais, McGill method, McKenzie method, traveled all around the country learning from all these gurus because I knew that there was not one approach that would solve everything. I knew there were nuggets from each, right? And my goal is to synthesize everything I've learned from the body side of things, but then also the brain side of things, right? Worked with pain psychologists, sports psychologists, counselors, social workers. Synthesize the best of the mind, the best of the body into one place when traveling all around the world so that people like you don't have to. All right, so if you're watching this and you are interested in getting some help, I invite you to apply, to submit your case for review. I review all cases personally. And apply to work together inside of the Glute Relief Accelerator program that I created, which teaches you, if you're still watching this, how to resolve your own pain so you're not reliant upon a very broken medical system and a very myopic medical system, right? Who sees things only their way. If you want to go to the orthopedic doc, sure, you can. They've got pills, shots, surgery. That's what's in their toolbox. If you want to go to the acupuncturist, guess what? You're going to get needles. All right? If you go to the chiropractor, guess what? You're probably going to get adjusted. You go to PT, you're probably going to get some stretches and probably a sheet of exercises, going back to reason number 2, lack of scientific approach. They just don't know what they're doing. All right? And so, again, at any given point, you want to find someone who's worn multiple different hats, and not only on the physical structural side of things, and understands all those approaches. So if one thing doesn't work, we can shift. But then also on the mind, right? Because as we just talked about, you've got to consider this. You've got to consider that if you're here, it's for one of the 4 reasons we just talked about, which would, just to rehash, number 1, it's your pain experience. You are in a position of power or potential power, but not right now because nobody's teaching you what you need to do. All right. The second thing is lack of a scientific method. So if you're going to see people for your back butt sciatica problem and they're giving you a sheet of exercises, you should probably turn around and go somewhere else, because if they scientifically were able to figure out what to do, right, you would be able to see an immediate change in your symptoms. And oh, by the way, they wouldn't be giving you any more than 1, maybe 2 things. The third thing is that most providers are missing a key component of what it means to help you get out of pain. They're looking only at the body, and they're forgetting that you have a head connected to you, right? A head sitting on top of your body, and they don't understand how the two are connected, all right? And they don't know how to help you break out of that feedback loop, all right, that negative feedback loop, and spin it into a positive feedback loop so that you can get on with your life. And then the fourth thing is myopic treatment. Most providers, they go to school for one thing and they stop there. They stop there. They stop learning. They don't look outside of it because they're a specialist, right? But in order to be a specialist, at first you have to be a generalist. You have to be able to, if you ask me, wear all these different hats, talk the talk, be able to talk about this approach and this approach and this approach and this approach, not only in the body, but then also the mind. And again, that is what I've attempted to do with my career, to help people like you who are in pain and looking for an outside-the-box approach that literally leaves no stone unturned, okay? Doesn't mean we know everything, doesn't mean I know everything. It just means at the end of the day, we've tried to do the best we can to synthesize everything on the body side, all the different methods, pretty much. On the mind, all the different methods, and the best of that. Combine that with the best available research, what we know, the latest, most cutting-edge stuff. We synthesize it and we put it inside of a program to teach you what you need to do to get out of pain. So again, if you're interested, go ahead and click the apply link to work with me. Submit your case for review. Again, I review all cases personally. If we feel we can help, awesome. If we feel we can't help, then we'll let you know. All right, we'll be very upfront about that. All right, hopefully this is helpful. Again, this is Dr. Charlie PT. If you are someone who has given up, if you're saying, hey, I'm super skeptical, Charlie, I've been told by so many people that they can help me and I've just seen no results, no progress, then have you quit? Have you given up on yourself? Or are you still going to try other treatments? And if you're going to try other treatments, find somebody who understands not only the mind, but also the body, and has traveled around and can not look at things myopically, but instead holistically, and understands all the different approaches that you have, right, to potentially solve this, so that you, again, leave no stone unturned and you have the best chance of resolving your back, butt, or sciatica pain, okay? Again, this is Dr. Charlie PT. If you're doing well, click the apply link if you need help below. Thanks.